I'm Tammy Johnson. I'm here to show you the male Peri care skill. I'm saying Peri care. In your book it says perineal. I will use the terminology Peri throughout these videos, and I would like you to also, because it's easier to say and remember, okay? So we need on this skill your gloves, a bath blanket, a bed protector, towels, washcloths, a basin, and your soap. And we're going to begin. Hi, Mr. Jones. I'm Miss Tammy. I'm here to perform male Peri care. Hand hygiene, pull the curtain, and as you're pulling the curtain, I would like you to pick your basin up and say that's when you would get your water. And at this time, we're going to go into a very critical step of raising the rails. We always raise the rails when the bed is moving up or the bed is moving down. This is a critical step, and if you miss this step, you will not pass this test. That's a very important thing. Now I'm going to come over here. I'm going to raise the bed to a level that's comfortable for me, and I would want it to be comfortable for you. I shouldn't see you bending over, and I shouldn't see you tippy-toeing. So it should be really at a good level for you. Lower the rails next to you. If the call light is laying on the resident, I kind of just put it under the pillow. It's a safe place to put it, so you don't have to worry about it falling into the floor. I'm now going to take my bath blanket. I will not unfold it until I have laid it on the resident. Unfold it completely to assure that it covers the mannequin completely, the resident. I'm going to cover them up, because when you turn them, the state instructor will be standing here next to you, and I want to make sure that you have them well covered, that we don't shake the linen, because of the bacteria and the lint particles can cause them to get sick. Now I usually just hold this and pull it down. Occasionally, if I feel like I'm going to have trouble, and it's okay for you to do this till you learn, tuck it up here under their shoulders and just go down past their private area. You do not have to go down any farther. Some of the videos we have took the sheet down past the feet, and we don't have to do that on this skill. I'm going to put my gloves on. Now at this point, you could have put your gloves on when you put the bath blanket on, but it is very important that you never put your gloves on and touch the side rails. We never touch the side rails with gloves on in any skill. So now I'm going to get this all straightened. I'm going to just expose the area that I'm working on, but I'm going to pull it back a little bit more than normal so that you can see what I'm doing. So here we go, so that you can see. I'm going to ask the resident to bend their knees, to bend their knees and kind of flex their legs. This is not going to happen with the mannequin. It's not going to happen with most residents, but you can say it if you want to, but it's not going to, you don't have to do it. I'm going to take my bed protector, and I'm going to, it's kind of large, so I'm just going to use, I'm going to fold it into a half, because we just need to cover the area that we're working on. I'm going to kind of lift his hips up and put that under there to protect the bed. And then I'm going to, you can start with the mitt, but I usually don't. I just go ahead and open the washcloth, because we've got some areas that are small to get into. So you don't necessarily have to make a mitt on this one. I'm going to put some soap. Now in your skill book, it is saying to work downward. Now that is assuming that you're grasping the penis and it's held straight up. So it's kind of like holding it up, and then I'm going to work. Now this is an uncircumcised male, so I'm just going to circle around the meatus at the tip, just kind of moving the washcloth as needed. And then I'm going to take a portion of the washcloth holding, and I'm going to wipe away from the meatus. So I'm just washing till clean. I'm going to observe the scrotum for any redness or irritation. I'm going to wash the scrotum, And then I'm going to get the washcloth to rinse, and I'm gonna rinse that same area. A circular motion around the meatus till it is clean, till it's rinsed, and then wiping, always wiping away from the meatus. That word looks like meatus in your book, but it's meatus. And then I'm going to rinse the scrotum, and then I'm going to pat dry that area, and then I'm going to take the bath blanket. I like to touch the bath blanket, not the sheet if possible, and then we turn residents. We do not flip them. We flip hamburgers, but we turn residents. So we're going to turn them with their shoulder and their hip, bend my knees a little bit, lay him up against the side rail, and get your bed protector straightened out. I'm going to throw this back so you can see what I'm doing, but when you're at state, you try to keep everything covered as much as possible. Now I am going to make a mitt this time. And I'm going to put soap, and I'm going to wash from the scrotum to the anus. Coming out here, turning this washcloth each time. I will wash till it's clean. I will make a mitt, and I will get some water. I'm going to rinse, and I'll rinse from the scrotum to the anus, turning this washcloth each time, and I will rinse till clean. I will pat dry, and I will remove my bed protector. Anytime in any skill that you remove a bed protector or a towel, either whether it's underneath them or on top of them, at that point you remove it, you put it in the hamper or the trash. You always remove your gloves. You do not want to be touching the rest of the linen in your resident with gloves that is soiled. I'm going to hold the resident by the shoulder and hip, lay him down, and I want to stop for 1 second and discuss if the state instructor says this is a uncircumcised male, you do need to, at the point of where you're cleaning, you need to say that you will pull the foreskin back, clean just like I taught you, and then put the foreskin back in place, okay? She will let you know whether it's circumcised or not circumcised. So pull your sheet up, roll your back blanket down, roll your back blanket away from you, put it over here. Now we're back to a critical step, putting the side rails up. Very critical that we lower the bed back down so that it's in a low position. Lower the side rails. Lower this side rail because that's a critical step, and if you forget that, you will not pass this skill. I'm going to kind of straighten them up. Make sure they're comfortable. I always like to say that with every skill. Another critical step is the call light. Hand hygiene, report and record. Thank you.